Disorders and diseases of the skeletal system. The objectives of this lecture are to name and describe major disorders of the bone and joints. Spinal deformities. When we talk about spinal deformities, we talk about lordosis, kyptosis, and scoliosis. The etiology of these can be congenital, poor posture, bone disease, and growth disorders. Some of the symptoms of all three of these will be back pain or discomfort. The diagnosis, we usually diagnose this by X-ray of the spine and possible MRI scans. In the treatment, we eliminate the causative factors. If there's poor posture, we work on strengthening the musculoskeletal system. And sometimes we will use bracing, and spinal surgery might be necessary in severe cases. Osteoporosis is a metabolic bone disease caused by porous appearance of bone and leads to the decrease in bone mass. We often think of osteoporosis as the Swiss cheese of bones. So there's big gaps and holes in the bone fibers. The etiology is age, postmenopausal women, a decrease in estrogen is mainly part of it, and our lack of ability to contain calcium within our bones and exercise. Symptoms: compression fractures, kyptosis, or easy fractures can happen, and these are all signs of osteoporosis. Diagnosis: X-ray scans, CT scans, but the most common is a bone density scan or a DEXA scan. Treatment: there's no treatment to reverse, however there are treatments to stop the progression through medications such as Fosamax, Evista, Boniva, Reclass. Sometimes we'll give patients estrogen, and we will really bump up their calcium and vitamin D supplements. We also recommend that patients exercise. A lot of times in elderly people we recommend water aerobics because it's a lot less weight bearing. So here's a picture of normal bone and how it's supposed to look, and here's a picture of osteoporosis, so you can see the thinning of the bone material. I also included a chart for bone mineral density testing. So if you are greater than -1, you have normal bone mineral density. If you are in the -1 to -2.5 range, you're in the osteopenia range, and oftentimes we will just tell patients to increase their calcium and vitamin D supplementation and implement an exercise program. And then once you get to that 2.5 range or higher, you are at high risk of fractures, and oftentimes that's when we start putting you on other medications such as Reclass, Evista, Boniva, and those sorts of things. Osteoporosis risk factors: so alcohol use, corticosteroid use, low calcium, low estrogen, smoking, and sedentary lifestyles can all lead to osteoporosis. So it's important to, when you are in your younger years, to get adequate calcium into the body so it can be absorbed into the bones. Osteomyelitis, which is inflammation of the bone. So the etiology of osteomyelitis is oftentimes a staph infection from a wound or a strep throat infection, or I shouldn't say strep throat, but a throat infection. It occurs in the long bones and typically in children. Symptoms are fever, chills, tenderness over the area. Diagnosis: physical exam with an elevated white blood count, or ESR, or erythrosedimentation rate is what ESR stands for. Those are blood tests that we can do to try and determine whether there's an infection. X-ray, CT scan, or MRI. Treatment, aggressive IV antibiotic therapy, and oftentimes we will have to do bone debridement to get rid of the osteomyelitis. Osteomalacia is soft bones due to defective mineralization in adults. We call this rickets in children. Etiology is a deficiency in vitamin D due to inadequate intake or inadequate sunlight exposure. Symptoms are bone pain, loss of height, bending, and deformity of the weight-bearing bones. So as you can see here in the picture, you'll see a bowing in the femur, and this is oftentimes what we look for in osteomalacia. Diagnosis is patient history, serum vitamin D levels, and X-ray to look for cracks. Treatment, we oftentimes, the only treatment we can do for this is supplementation of the vitamin D, and we oftentimes recommend about 2,000 international units daily. Osteoarthritis and degenerative joint disease is a degenerative process or wearing out of joints caused by an inflammatory response in the joint. The etiology for this is unknown. Sometimes it can be sports injuries, which can speed up the process. Symptoms are swelling, pain, joints can become crooked or deformed, decrease in joint motion or grinding sounds. Some other symptoms, especially if it's related to the spinal column and the vertebrae, are especially in the lower back. We talk about sciatica, which is severe pain that radiates down the leg and is due to when the vertebral column narrows and pinches on the sciatic nerve. The diagnosis, history and physical exam, X-ray sometimes, but this does not always correlate. Sometimes in spinal degenerative joint disease, we will do CT scans or MRIs. Treatment, rest, heat, analgesics, anti-inflammatory medications, steroid injections, and sometimes surgery is warranted depending on which joint has the degeneration. This slide shows osteoarthritis and the changes in the joints. As you can see, inflamed, bigger. Rheumatoid arthritis is an autoimmune disorder causing stiffening of joints. The etiology is unknown. Symptoms, all joints can be affected with noticeable deformities. Diagnosis, physical exam, we will sometimes do blood tests such as rheumatoid factor, anti-CCP antibodies, and ESR to mark those inflammatory processes. Treatment, analgesics or anti-inflammatory medications. Sometimes we will use medications such as Neura, Imuran, Enabril, Minocin, Humira, just to name a few. And then corticosteroids, sometimes we will use short-term, but oftentimes we do not like to use these for long-term use as it can severely affect the pituitary glands and their normal function. So here is an example of rheumatoid arthritis. As you can see, the deformity in the joints. Gout is a deposit of uric acid crystals that affect the joints. So as you can see in the picture here, uric acid oftentimes will deposit in a toe joint or in the knee are the most common joints that it will affect, and then cause inflammation of that joint and cause severe needle-like pain. The etiology is a metabolic alteration in the breakdown of certain protein foods. Symptoms are redness, heat, edema, pain in the joint. Diagnosis is a uric acid blood test. Treatments, sometimes we'll give medications such as allopurinol or colchicine. Anti-inflammatory medications such as ibuprofen, and then a low-fat diet. This is oftentimes related to a really high-fat diet, and oftentimes has been called the King's disease. Hallux Valgus is also called a bunion. The etiology is controversial by experts, but sometimes people will say it's an inherited thing, and sometimes experts will say it's due to improper footwear or wearing high-heeled shoes in women. Symptoms are redness, pain, edema in the area. Diagnosis, X-ray, treatment, proper shoes, anti-inflammatory analgesics, and sometimes we will need surgery for those that are really protruding. Here's an example of a protrusion of a bunion. TMJ, or temporal mandibular joint syndrome, is an inflammation of the joint. Etiology, a joint tissue lesion. Overbite, improper dental work, or poor fitting dentures can often lead to this. Symptoms are severe headaches, pain in the jaw or clicking in the jaw. Diagnosis, X-ray, CT scan, or MRI, and oftentimes we have to treat it by doing surgery. And this slide shows the TMJ joint is a hinge or a gliding joint that is most constantly used due to eating. And what happens is this disc, or sometimes the ligament, can let go of this disc and the disc can slip, or there can be oftentimes a degeneration in this disc, which then provides no padding within this hinge or gliding joint and causes the grinding or the clicking of the joint. Ganglion Cyst is a fluid-filled benign tumor that develops on a tendon near the wrist area. The etiology is unknown. The diagnosis is really by physical exam and looking at it, and treatment is incision and drainage, and sometimes surgical removal is needed if the incision and drainage does not work. Osteosarcoma or Chondrosarcoma is a malignant neoplasm of the bone. Etiology is unknown. Symptoms are severe pain, and the diagnosis is a CT or MRI scan. Sometimes we'll do white blood cell counts and a PET scan. Treatment is removal of the tumor, chemotherapy, and osteosarcoma only. Paget's disease is the overgrowth of new bone which is thicker and weaker than the normal bone, and typically affects the pelvis, spine, and long bones. Etiology is unknown, mostly asymptomatic. Bone pain is generally at night. Diagnosis is of X-rays of the area, and the treatment, there is really no treatment. However, calcium and vitamin D can be beneficial in bone strengthening. Bone fractures. Open or compound fractures pierce the skin, and closed simple fractures do not. Fracture types include complete, incomplete, linear, transverse, and oblique. So this slide shows an open which punctures the skin. An A. B is a closed that does not puncture the skin. Complete is where the bone separates completely. Incomplete is where the bone separates partially. We oftentimes will call this a green stick fracture. A linear fracture is a parallel line, as you can see in D here. A transverse fracture is where the fracture makes a right angle. An oblique fracture is a diagonal, or sometimes will spiral around the bone if it's in a long bone. And there are a couple of other types of fractures. There's a commuted, which is fragments, so there will be fragments within the fracture here impacted is where the fragments are driven into another bone. This oftentimes will happen in your radius or your ulna where there are other nearby bones, or the tibia and fibula. And an avulsion where the bone is pulled free by a violent muscle contraction. So if there's a muscle tearing or a really quick muscle jolt, it will sometimes pull the bone away from, it will pull a piece of the bone away from the other parts of the bone. So traumatic injury, dislocations or subluxation is an articulate surface of the bone in the joint where they are no longer in proper contact. Sprain is an acute injury to the ligaments around the joints. Ligament is the key term. So for sprains, it is ligaments only, and ligaments attach bones to bones. So we need to keep sprains and strains apart. You will need to know the difference for your exams. Strain is an acute injury to any part of the musculotendinous unit. So meaning that strains affect tendons, and tendons attach muscle to bone. So sprains are ligaments that attach bone to bone, and tendons are in strains which attach muscles to bones. So make sure you identify the differences between those two.